Hello friends, welcome to our channel PKR Vibes Career and Growth. First of all, thank you for your time to spending here to learn something new today. Today we discuss about occurrence codes and UB4 claim form. First we all of you know that UB4 is a medical claim form which is used by hospital buildings or institutional buildings. So generally, these hospital claims are submitted to the insurance companies by using this UB4 claim form. UB4 claim form is also known as a CMS 1450 medical claim form. So why? Because it is developed by CMS, Centers for Medicare and Medicaid Services, and approved by the NUBC, National Uniform Claim Committee. I mean NUBC Billing Committee. So guys, this UB4 claim form having 81 field locators are known as a boxes. So but generally we will call like a field locators or fields or field locators or boxes. So total 81 boxes are there, and we already discussed about field location 1 to 7, that is about the provider information. So complete provider information we can see from boxes 1 to 7, and field location 8 to 17. So about patient demographic information. So if you want to learn, I mean if you want to see or if you want to enter any patient related information, then we have to look into the boxes of 8 to 17, and we already uploaded those videos, and field location 8 to 30, we already discussed about the condition codes. So generally, in medical UB4 claim form, we have a like condition codes and occurrence codes. So generally, today we will discuss about occurrence codes, and the previous videos, whatever I already discussed, field location 1 to 7 and field location 8 to 17 and field location 8 to 30th, 30, I already uploaded, and also I will provide the links in the first comment of this video. So kindly explore the links respectively for more information. Okay guys, here field location 31 to 34 is about occurrence code and dates. So here occurrence code is describe specific events related to a claim with a specific dates and its billing period. So here occurrence code is nothing but it is describing about specific event. For example, here I given occurrence code 01. So 01 is telling about accident or medical coverage. So whenever accident was done to a patient, so that is known as a specific event. So here the specific event is nothing but accident. On which date the specific event was done is known as a specific date. So generally, whenever you are submitting claim to insurance, which is you are related to your accident and UB4 claim form, we should have to enter occurrence code as a 01 and date as a accident done date. So that is known as a specific event on a specific date. That is known as a occurrence code. So I given like 04 as a one more example. 02 is no fault insurance, and if you are submitting any claims related to no fault insurance, then we should have to enter 02. 04 as a employment related. So in office premises or employer premises, if you got anything related to that incident, then at the time then you should have to enter 04 as a specific event code, and specific date as a on that particular date when was done incident. So that is what we are occurrence codes is explains. So generally 24 also I given one more occurrence code example, that date insurance denied. So 40 and 42 are also occurrence codes are used together to indicate patient's scheduled admission date and the date of their first pre-admission test. So generally we have to understand that these occurrence codes are telling about the specific event and on which date it was that event was occurred. So this is about occurrence code and date. So from the field location 31 to 34 we have to enter on a UB4 claim forms. And field location 35 to 36 is nothing but occurrence span. So guys, here occurrence code and occurrence span are both are related to same meaning. And here occurrence span is nothing but specific event during the period of time. There is a specific period of time. So generally, occurrence code is nothing but a specific event on a particular date. Coming to occurrence span code is nothing but a specific event over a specific period of time, not only one date, like date range. So here, for example, I given occurrence code as a 75 used to indicate the dates of period at a non-covered level of care or otherwise covered stay. For example, there is a non-covered or covered uh, benefits are there. So whenever there is a non-covered service you are taking from the insurance, I mean from the patient, at the time you are submitting claim to insurance by using occurrence 75 is telling that these are the non-covered services. So generally, but you are submitting claim to insurance to getting that non-covered level of care also. So or otherwise sometimes you are expecting that you have to bill to insurance to the non-covered things. So they are understanding that this kind of services non-covered and also patient also aware of these things. Or otherwise some covered stay. For covered stay also you should have to enter like, okay, these are the covered stay, so I want payments for this. At the time you should have to enter occurrence code 75. And this is telling that from this date to this date of period the services are covered for the staying in a hospital. So if you are entering occurrence code 72 used to indicate the dates of period of the first and last dates of outpatient services when the billing records doesn't represent the actual date of service. Guys, here for example, patient is visited doctor every day, like every day a week. So a week every day the doctor is, I mean visited, I mean patient is visited to doctor to get the treatment as a outpatient services. So at the time whenever you are submitting hospital claims to the insurance companies, these outpatient service ranges are there. At the time there is no specific date of service, every day is taking service for a week. So at the time we have to use occurrence code 72 is telling that the first date of outpatient service whenever taken by the patient and also the last date of outpatient service whenever the patient is taken the service from the doctor. So at the time we have to use occurrence code 72 and also occurrence span from the first date to last date. So here simply we have to understand that the occurrence code and occurrence span is only the difference is date of I mean date range, period of specific period of time. So from to through, like there is a date range. So that is what we have to done that, but the meaning is the same. The meaning is nothing but a specific event was done at a particular date range, period of a time. That is the occurrence span. Guys, here the box numbers 37, I mean field location 37 and UB4 claim form is a blank. So that is used for future use. And generally, this is given as a blank by a National Uniform Billing Committee guidelines. Guys, if you are watching our video first time and if you not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth and hit the bell icon so that you will get every our video as a notifications to your mobile. And if you felt content is useful, could you please like our video also so that it will reaches many more needy people. And again, thank you for your time and thank you for watching. Have a good health. Bye for now.